This year on World Diabetes Day, we are here to raise awareness on the importance of healthcare professionals in supporting people with diabetes. People with diabetes face many challenges, and we are here to shed a light and have a conversation on how best to support them. It is incredibly important for all of us to raise our awareness and educate ourselves on how people with diabetes are suffering, as well as educating ourselves on the expertise we should be referring to doctors and diabetes educators in supporting people in managing their diabetes journey. I'm joined here by two healthcare professionals, a doctor as well as a diabetes educator. Thank you so much for joining us here for this conversation. Could you please introduce yourselves and let us know a bit about your background?
Sure. So my name is Dr. Jalal. I'm an endocrinologist working in Dubai Diabetes Clinic. We're a group of endocrinologists, diabetes educator, dietitian, podiatric and retinal specialist. And we try as much to give the most comprehensive approach for a patient with diabetes. So, we don't want just the patient to come and see endocrinologist and just take the medication and go home. We need to make sure that they take the education they need. You're going to be surprised at how many people with years of diabetes, they don't know basics about diabetes. A lot of people with diabetes, they will think they know everything about diet. Most of the information is wrong. A lot of patients with diabetes, they may not have an eye exam or feet exam if they need. So I think it's very important to try as much as to give them the most comprehensive we can do. And of course, if they need a different specialist, sometime if there's a question of cardiovascular disease or renal disease, then of course we refer them to the appropriate specialist to take care from there.
Hi, I'm Rana Dabbous, diabetes educator working in Dubai Diabetes Center. Actually, I work closely with patients with diabetes more than 10 years, and I can say that diabetes education, it's a very important part on helping patients how to do the self-management since they are living with diabetes. Diabetes education is providing and supporting and do a process of facilitating of knowledge, skills, ability necessary to self-care for the patient.
As someone whose career focuses on endocrinology disease, how do you best describe your role in the treatment of patients with type 2 diabetes and cardiovascular risk?
Type 2 diabetes is a cardiovascular risk equivalent, so they need to be treated very aggressively as you treat somebody who has established disease. So when a patient comes to diabetes, of course, education will be very important. They have to learn why we need to treat the other risk factors. We have to treat it at 360 degrees, so you have to look also at their blood pressure. You have to use what's more appropriate for that patient. Patient has to understand that they need to monitor their blood pressure. They have to understand that they need to take their statin. It's very common that the patient, for example, stop their cholesterol medication because somebody told them some story. And people, with diabetes, need this education to comprehend the fact that they're not coming to the endocrinologist just to get their sugar down. It's actually you have to get your cholesterol down, your blood pressure down. We have to look at all the other risk factors, smoking, for example. So you have to look at it as the same way when we treat diabetic, they're going to see sometimes podiatry, retina specialist, educator. This is the same way also. It's not only sugar, it's blood pressure, it's cholesterol, it's smoking, it's stress management. So it's kind of a holistic approach, if you want to say that.
And as a diabetes educator yourself, what is your take on this?
Yeah, well, when the patient come to our clinic, usually our main responsibility is to discuss with the patient the treatment plan that already with patient. So the plan, it's depend on the how the doctor will wants to treat the diabetes. But from our side, we usually focusing on helping the patient how he can use this treatment plan by educating the patient about medication, about the insulin, if they have insulin. And one also of the important thing that we need to teach the patient about the target numbers for the blood glucose, for the cholesterol. And as a diabetes educator, I noticed that most of our patients, they don't know about the complications of diabetes or the link between diabetes and cardiovascular disease or retinopathy. So this is also very important to discuss with the patient how diabetes, if they are not treating very well or not using their medication very well, maybe they can get the complications of diabetes.
Do you have a multidisciplinary care team approach for patients with diabetes?
Yeah, I mean, for sure. I mean, in the diabetes clinic, we try again to to have comprehensive, approach to the patient. So again, as I mentioned, we have a dietitian, educator, podiatry, retina, and again, it should not be just doctor. I mean, we evaluate the blood glucose, the blood pressure, and cholesterol, and we adjust the treatment. But still, you have to look at the education part, the diet part, and all that. Of course, there are going to be some circumstances that if a patient, worsen case in a way that their kidney function become to a certain degree, then at that time, of course, we have to communicate and send them to get evaluated by nephrologist. If patients show any sign suspicious of cardiovascular disease, even sometimes could be very mild subclinical. It could be a patient tell you that I feel a little bit short of breath every time I go up stairs. I mean, sometimes it could be so subtle that you have to keep a low threshold, since the diabetic have much higher risk. So if you see anything suspicious, you can go ahead and refer to the cardiologist. So try to keep it, again, very comprehensive, and don't feel shy to refer to a specialist that you think it's appropriate. It's better to be on the safe side sometimes than to miss somebody with a significant established disease.
And how would you say you best approach communication and education with your patients?
Yeah, actually in our clinic it's different a little bit than the endocrinologist. We usually discuss with the patient the target number and how he needs to follow the treatment plan to keep the blood glucose or the cholesterol level within the target number. So during the visit, also we talk about the complication, as we mentioned before, of diabetes. So we just tell the patient that he has to be not worry about the complications if he can keep his blood glucose or the cholesterol level within the target that we provide to the patient. So the challenge that we have, or one of the most challenge that we have, the self-monitoring blood glucose. So it's an important part to keep the blood glucose within the target range is to keep your blood glucose on the target that we provide to the patient. So he needs to do the self-monitoring to make sure that the treatment plan is working very well, since his blood glucose on the levels that we provide. So we face some patients that they refuse to do the self-monitoring, or sometimes they are not following the plan that we ask them to do it. Like if we need to do the testing of a blood glucose 3 or 4 times daily, they just come to the clinic with one. Sometimes they are coming without the meter, the blood glucose meter. So actually this is our role, to educate and support and convince the patient to do more self-monitoring. And most of our patients, they are listening to our advices, Sometimes it's take time to reach to this point, but I'm sure that most of the educators can reach to that point that they can see the patient following all the advices.
So how do you best communicate cardiovascular and endocrinology risk disease with your type 2 diabetes patients, and what are the challenges that you face?
I mean, in a way that patient with diabetes, of course, has already increased risk of multiple problems, medical conditions. They have high risk of cardiovascular disease, peripheral vascular disease, strokes, heart failure, sleep apnea, and so on. And so, of course, you have to kind of communicate it in a simpler version to the patient and try to explain to them that, number one, we need to be very aggressive, and we need to be aggressive early. We know that being aggressive early actually give you the most benefit. Patient has to understand that we're not only targeting the glucose, because most patients look at diabetes only as a glucose, and targeting the other risk factors that they need to try to achieve the best outcome. Of course, there's a lot of things that sometimes stop us from going to the point we want. Adherence is the major issue, of course. So patient may not take their meds, they forget to take their meds, or they refuse to take their meds. So you want to simplify, you want to minimize. For example, if they're taking pills, you need to make sure that the number of pills is less. If they're taking injection, maybe minimize number of injection. Some patients, for example, will refuse to check their glucose. And so you kind of achieve an agreement, say, okay, you don't have to check it 4 times daily, maybe 2 days a week, check it 4 times daily. So you have to achieve the best way you can with whatever the patient allow you to do. I mean, you can go to a dietitian and she give you a diet plan, but if you don't stick to it, it doesn't do anything. So, that applied to me, educator, dietitian, that you have to see what the patient to a certain degree allow. You have to kind of do some kind of negotiation with the patient. So, sometimes, you can get them the same benefit with a little bit of tweaks to try to get the best you can.
And how do you feel is the best way to approach communication and educating your patients at the same time?
Well, I can tell you that I am really very lucky that I'm working with the team approach because, as you know, diabetes it's not only need to discuss with the patient about the medication. It's also need to discuss with the patient about the lifestyle modification, including the food diet or the exercise plan that he needs to follow. So since we have in our team approach dietitian, we can refer the patient based on their needs. If we need to put a plan for exercise, or if we can see that the patient he needs to do exercise to lose weight, if he's overweight or he has obesity, we can refer the patient to the exercise clinic so they can help the patient to do exercise based on his body weight or his condition.
So, Doctor, how does the level of patient awareness help in terms of guiding them through their treatment guidelines?
I mean, again, education is very important. The problem now with the internet age, most patients use Google to a certain degree to try to figure out their information. And, so when a patient comes to you, sometimes they actually come asking for a certain drug, for example, for treatment of diabetes. And, it is important for us to kind of explain to them the newest guidelines, because this keeps changing every year. And explain to them sometime that if whatever the request may not be really appropriate for them. And why is that? They may ask you because a friend took it. So, of course, we're not going to show them guidelines and go over it, but we try to explain to them that, for your case, for your condition, this is typically what's more appropriate and is because of, that and that. So we keep it in that simple of term, to try to achieve the best we can do for our patient.
And how best do you see combining the patient awareness as well as their treatment guidelines from your perspective?
Yeah, when the patient come to our clinic after finishing with the doctor, we usually make sure that he knows very well the new treatment plan and try to explain the treatment plan to the patient. And we usually ask the patient if they have more questions about it. Also, it's very important to make sure that the patient emotionally satisfied with his treatment plan or not.
So what are the gaps we see between specialists when it comes to treating type 2 diabetes patients, and how do we fix it?
I mean, that's really sometimes the hardest part to treat. You know, at least in my part, in my small world, I make sure that if they see another specialist, to bring the record from the specialist, to bring their lab they did, and to bring their medication, actual medication, because I need to make sure there is no doubling of medication. I mean, you know, I see a lot of time that patient may receive a medication that they already taken with us. So you want to make sure that you avoid this kind of error that can happen. There are sometimes, of course, I may have a question. I know, for example, a patient see cardiologist, and so I may type the question on a letter, address it to the cardiologist, stamp it, give it to the patient, and tell him when you see the cardiologist. If I have access to his contact, I may contact that physician or email them, because sometimes it's really hard to get people on phone. You know, if you want to be in a somewhat more perfect world, then maybe you should address patient with diabetes and complication in a separate way. So, for example, if you have a patient with diabetes and have established cardiovascular disease, then you may want to have a joint clinic. So, you know, where diabetic specialist or endocrinologist or cardiologist will share, and so they can share opinion. So they're doing, you know, in the same time. So you have the same time for the clinic. The same thing if you have a patient with renal disease, that maybe it's better to see the nephrologist and the endocrinologist at the same time. And that will make the coordination of effort better. I think sometimes patients, when you see multiple specialists, especially if they're older patients with diabetes, they get confused and they run. And sometimes they may hear something from one of the physicians and they misinterpret it, and they come to you and tell you a story. And so it's better that if you, and next door is the other specialist, you can just knock the door and ask him, you just seen this patient, what do you think? You know, that will be even better.
So more and more families are aware or know of someone who has type 2 diabetes, and with World Diabetes Day and us raising awareness of the disease, any last words that you would like to share with patients?
For all patients with diabetes, you know, diabetes is a disease that we can treat, that we can beat. It is very manageable. It takes hard work, of course, from the patient side and us, the provider. We have to look at treating diabetes as a comprehensive 360-degree. But by doing that, you know, we can prevent almost all the complication. We can significantly reduce the risk of cardiovascular disease. And of course, if we have a good control of the cholesterol, blood pressure, and the glucose level, there should be no diabetic who need to go to dialysis, and no really diabetic who need amputation from neuropathy. I mean, this is very manageable, the disease.
My message for all patients who has diabetes and their caregivers, that take your time to learn, feel free to ask, don't feel shy to ask whatever you want to ask about your diabetes. We are here to support and help you to fight diabetes.
Thank you both so much for being here and sharing such invaluable advice to so many people watching. And as we celebrate World Diabetes Day, all of the month of November, we'd like to just raise awareness and make sure you know to further educate yourself when it comes to the disease. Share it with your caregivers, patients of diabetes, as well as healthcare professionals. And please do not be afraid to ask the questions that you want to ask. We wish you all the health and stay safe.